I want to talk to you about pain in women. And I will say right off the bat, this is 10 times worse if you're a woman and of a minority. Talk about a couple specific studies. So women's pain was underestimated, like in all of these studies, because of a false belief that women are oversensitive to pain and express or exaggerate it more easily. It's not just male doctors, like both men and women often discount women's verbal reports and nonverbal behavior expressing pain. Female patients were perceived to be in less pain than male patients at the same level of pain expressiveness and pain self-reporting. The perceivers persistently rated women's pain as less because they felt they were over-exaggerating it. There's this general belief that men wait longer to go to the hospital for things. So, they must really be in pain.
All right.
They're more stoic than women and less expressive. So if a man's being expressive, he must be in severe pain. Ever seen a man with a man cold? I've seen you with one. They would also overestimate the pain that men were in.
Oh.
So it wasn't just underestimating women's pain. It was overestimating men's pain too.
Shouldn't you just overestimate everybody's pain?
80% of pain studies are done on males, which develops the norms without the data of females.
Right. Dosages by weight don't make sense then, right?
Yes, exactly. And women respond differently than men do to certain pain medications.
Different side effects probably too.
Yes, different side effects too, yes. Few studies that are done specifically on women about pain, that do exist, prove that women feel pain more intensely than men. But it's due to their nervous system, not due to their emotional, they are more sensitive to pain. So it means that their pain needs to be treated because it is very real.
Yeah.
How does this play into real life situations? This particular study was done on abdominal pain. So in the ER in the United States, women wait about 65 minutes before receiving any kind of pain medication for acute pain. Men only waited 49 minutes. Same thing in just waiting in the emergency room, waiting room. Women wait longer than men for the exact same symptoms. Women are 7 times more likely than men to be misdiagnosed and discharged in the middle of having a heart attack. Why?
7 times?
7 times. Why? Because the medical concepts of most diseases are based on the understanding of male physiology.
Yeah.
And women have altogether different symptoms than men when having a heart attack. Moreover, when the perceivers in these studies were asked to recommend either psychotherapy or pain medicine to each patient, 62% recommended pain medication for men versus 58% for women, and psychotherapy was chosen for only 38% of men versus 42% of women. In these studies, it was the exact same condition.
Yeah, right.
So it was a apples to apples
So all
thing.
of the variables are pretty much accounted for.
Yes. So sex was the only thing that remained.
So even if there's a 4% difference may seem small, but when it's the only variable, there's an obvious problem.
Yes, exactly. We're going to talk about race now. One study that they did a sample of 222 soon-to-be healthcare professionals. Researchers found that about 50% of the medical students and residents attributed higher pain tolerance to Black patients compared to white patients. These students falsely believed Black people have less sensitive nerve endings, thicker skin, or stronger immune systems, so therefore would require less invasive pain care than white people.
What percent?
50%.
That is...
Okay. Another study they did on children showed that only 12.2% of Black children were offered opioids compared to 33.9% of white children who were experiencing appendicitis.
Oh, no. Oh, no.
And when both would describe their pain as moderate, Black children were less likely to receive any pain medication at all. So if a child goes in explaining their pain is moderate and you're Black, the chance of you getting pain medication is a lot less. White children, they did a study on them to see how soon does this bias about pain and being Black start? How soon does this bias about pain and being Black start? White children, they did a study on them to see, had them rate each other's pain, and they were able to pick up on a weak racial bias by the age of 7 years old and a strong and reliable bias by 10 years old.
Whoa. Why?
Often, white participants superhumanize black people, which is really dehumanization, but superhumanize them, and attributes like these power capacities to black people in order to justify beliefs that they're inherently more resilient when hurt.
7, why would you be thinking that at age 7? I have no idea what I'm talking about. I just know that that is wild by age 7. And then what did you say, age 10?
Age 10, it was reliable and strong bias.
What the heck? That is a symptom of a sickness.
So then you add in being a woman and being black and having chronic pain issues like one of our dear friends has.
Yeah.
And she cannot get relief.
You're just not freaking listening to her.
No. It's bias upon bias. Stacked. It's stacked.
Yeah.
These pain bias go back far, rooted in slavery and all of the experiments we did on black people and all the medical advances that we owe to black people. The history of gynecology, real fast, physicians saw a real opportunity in the institution of slavery to elevate themselves, and they took it. You had these slave owners that would have these women have babies, and they would develop sometimes fistulas. Do you remember what a fistula is? It's basically, it's a tunneling. Yes. You have a hole or a tunneling where something should not be in it. This guy with the last name Sims, who is considered the father of gynecology, obtained slaves who has these problems. And these slave owners are letting them do this. And in fact, they're motivated. They want to get these women back out and working or childbearing. So while some doctors didn't trust anesthesia at that time, Sims didn't use it, any kind of numbing agent, because he believed that black people didn't experience pain like white people did.
Oh my God.
And he's quoted as saying, "There was never a time that I could not at any day have had a subject for operation." And it was the most memorable time of his life.
Oh gosh.
Let's talk about a girl named Lucy. The reason that we know how to repair fistulas today is because of these 17, 18-year-old girls that underwent many unmedicated surgeries and died from sepsis. This guy with the last name Sims, who is considered the father of gynecology, tamed slaves who has these problems, right? Some doctors didn't trust anesthesia at that time. Sims didn't use it because he believed that black people didn't experience pain like white people did.
Oh my God.
A girl named Lucy, 18-year-old Lucy, given birth a few months prior, couldn't control her bladder. During the procedure, patients were asked to perch on their knees and bend forward onto their elbows so their heads rested in their hands. And Lucy endured an hour-long surgery, screaming and crying out in pain. As nearly a dozen other doctors watched, as Sim later would write, Lucy's agony was extreme. I thought she was going to die. It took Lucy 2 to 3 months to recover entirely from the effects of that particular operation. But there was multiple operations done. I'm 17 years old. Anarcha had 30 operations. Those are just 2 of the women. There were so many women. Those are just 2 of the women that I chose. Until he finally perfected his method. And that was after 4 years. No anesthesia, no pain medication. Then he was able to do it on white women, but of course he used anesthesia.
Yeah.
So thank you to these women. This guy with the last name Sims, who is considered the father of gynecology. Before and after his gynecological experiments, he tested surgical treatments on enslaved black children. Doctors didn't trust anesthesia at that time. Sims didn't use it because he believed that black people didn't experience pain like white people did.
Oh my God.
One of the things was in an effort to treat neonatal tetanus, which is a form of tetanus that was acquired most likely through using unsterilized instruments to cut the umbilical cord. He had very little success. Why did he have very little success? Well, he believed that African Americans were less intelligent than white people and thought it was because their skulls grew too quickly around their brain. And he would operate on African American children using a shoemaker's tool to pry their bones apart and loosen their skulls. And in the 1850s, Sims moved to New York and opened the first ever women's hospital, where he continued testing controversial medical treatments on his patients. And anytime anybody died, he blamed, according to him, quote, "The blame laid squarely on the sloth and ignorance of their mothers and the black midwives who attended them." He did not believe anything was wrong with any of his methods.